Hi, I'm Denise Willis, and today I'm discussing a paper from the July 2021 issue of Respiratory Care entitled Practices and Perceptions of Face Mask Use in a Pediatric Health System During the COVID-19 Pandemic. I'm one of the authors, and this study was a collaboration between respiratory and nursing at my institution. I'm a research respiratory therapist at Arkansas Children's Hospital, and I am also a section editor for the Respiratory Care Journal. I do not have any conflicts of interest. Face coverings are recommended to help mitigate the spread of COVID-19. Guidelines for wearing face masks have evolved since the pandemic began and continue to evolve as more is learned about the virus. However, the use of face masks to decrease virus spread is not a new concept. It was recommended practice even during the 1918 influenza pandemic. The aim of this study was to evaluate practices and perceptions of face mask use by staff of a pediatric health system. Sub-aims included evaluating the differences between clinical and non-clinical staff, and also between clinical staff who do and do not provide patient care. The study team developed a survey that inquired about the type of face mask worn, how the mask is handled and cared for, challenges or health issues associated with wearing a mask, and also an optional open response to describe other concerns. All employees were invited to participate, and responses were anonymous. Responses were collected electronically, and the survey was available for a 2-week period. The statistical analysis used descriptive statistics to summarize the results, and for the comparisons between groups, chi-square, Fisher-Exact, t-test, or Wilcoxon rank sum test was used depending on the type of data. This timeline provides a perspective for the time frame during the pandemic when the survey took place. The World Health Organization declared a pandemic in March of 2020, around the same time that the first case was reported in the state of Arkansas. The Centers for Disease Control recommended universal masking in April of that year, and the Arkansas Department of Health instituted a face mask mandate for the state just days before the survey was available. There were over 1,000 participants who completed the survey, of whom most were female and clinical staff. Nurses accounted for over half of all clinical staff, and non-clinical staff were mostly administrative type roles. 70% reported wearing a cloth mask outside of work. Cloth masks were worn on average of 3.4 days before washing them, and surgical masks 2.9 days before replacing. Hand hygiene with mask handling most frequently occurred after removing the mask, followed by before putting it on. The most common challenges with mask wearing were glasses fogging, skin irritation, and headache. Several also noted difficulty breathing and vision obstruction, along with a host of other issues. Looking at the difference between clinical and non-clinical staff, those in clinical roles were more likely to replace the mask when damp or wet and reported more issues with mask wearing. Clinical staff overall reported hand hygiene more often when handling masks. Non-clinical staff did report washing their cloth mask more often than their clinical counterparts, but the difference was not significant. There were few significant differences between clinical staff who do and do not provide direct patient care. Those caring for patients reported hand hygiene more often before removing the mask, as well as more issues and challenges. 5 themes and several sub-themes were identified from the open response question. Many staff felt unsafe due to coworkers, patients, and families not wearing their mask correctly, as well as reusing masks and other PPE that were once considered disposable. Many sentiments were expressed regarding beliefs about COVID-19, mask use, and mandates. Concerns were also noted about the availability of PPE and challenges with providing patient care. Some of the reported practices differed from recommendations. Cloth masks should be washed daily, and hand hygiene should be done routinely before putting on a mask and before and after removing it. There were differences identified between clinical and non-clinical staff. It was not surprising that clinical staff reported issues and challenges more often, since they are likely wearing a mask and PPE for longer duration than those who do not provide patient care. It is also important to note that the survey was completed early in the pandemic, and much has changed since then, as we now have vaccines readily available and are no longer having to practice PPE conservation to the same extent. Results from the survey were from one pediatric health system in the southern United States and can't be generalized to other pediatric institutions. Additionally, the adult hospitals had a quite different experience than children's hospitals in the early portion of the pandemic. In conclusion, we found that practices varied among all staff types. Many reported challenges with wearing masks, especially clinical staff. Most agreed with wearing masks, but some felt masks were not effective in preventing the virus, and many did not feel safe in performing their job duties. Thank you for tuning in. You can reach me by email if there are questions. Follow the journal on Twitter and Facebook and subscribe to Respiratory Care on YouTube to be notified when new content becomes available.